So many times we're focused on our traditional risk factors like high blood pressure, high cholesterol, and diabetes that we forget that women have unique risk factors that make us more prone for heart disease. For instance, there are hormonal things that can occur throughout our lifespan that truly can affect an increased rise in cardiovascular disease. These can include polycystic ovarian syndrome, metabolic syndrome, early onset of your menstrual cycle, requiring hormone replacement therapy, or premature menopause. So just those factors alone can increase our cardiovascular risk. Secondly, whenever we're pregnant, we have a unique stress upon our bodies. Hypertension in pregnancy, whether it be diagnosed before pregnancy, pregnancy-induced hypertension, or the onset of preeclampsia, is critical in understanding that it is a risk factor for long-term disease. Recent meta-analyses have actually shown that just having hypertensive disease in pregnancy actually increases our risk of not only cardiovascular disease, but heart failure, aortic stenosis, and mitral regurgitation. All of these relate to the later onset of chronic hypertension. In addition, there are other risk factors in pregnancy, such as gestational diabetes. Placental abruption is considered a risk factor, but also preterm birth weight of your child, miscarriages, or even early preterm delivery. It's difficult to really take a detailed history, but if you become very in tune with these unique risk factors and make it a part of your standard practice, you're actually less likely to miss things and get your patients the treatment they need earlier. Other unique risk factors are physical inactivity, but also just being overweight, and obstructive sleep apnea has a significant increased risk to our patients long term, including heart failure, onset of atrial fibrillation, and chronic hypertension. So using things and resources such as the Stop Bang questionnaire, asking questions about daytime fatigue, snoring, and waking up suddenly in the middle of the night are very critical in ascertaining whether your patient may or may not have sleep apnea. Other unique risk factors actually are rheumatologic disorders. And one of our standard risk assessment tools for women that has been more predictive is the Reynolds risk score. And this is because it actually incorporates the CRP, which is a reactive protein that is seen in inflammation. And if we see that this is elevated, it may trigger us to actually look for underlying rheumatologic conditions. And one of these reasons that rheumatologic conditions are very important in females is, number one, that they're more common in females, but secondly, they cause an inflammatory condition in the heart arteries that increases the rate of plaque progression and subsequent coronary artery disease. So I urge each and every provider, as well as patient, to number one, be very proactive. If you know someone who has some of these conditions, even when they're pregnant, tell them, hey, this puts you at risk for heart disease. Oftentimes, I tell my patients who've had a history of gestational issues, you flunked your stress test 10 to 15 years early. This is why we have to be proactive with your care. It's very difficult to get women to be proactive because, again, they're taking care of everyone else. But if we really want to be there for our families, we have to take care of ourselves first.